We are getting mixed messages, and I would like to leave the politics out of this because I think the American people want to hear from each of you on the science, on your medical backgrounds, on your experience. With that said, the president has said the virus is going away. We recently have seen back and forth between the president and your colleague, Dr. Fauci, in the news. Dr. Atlas has also spoken. He is a member of the task force about conflicting signals about wearing masks. The CDC guidelines have also changed in recent weeks. At the end of the day, the American people just want to know what is going on and who are we supposed to listen to.
Our strategy is clear, which is we want to reduce the number of cases, we want to reduce the number of hospitalizations, we want to reduce the number of fatalities that result from coronavirus because we, as the Surgeon General said, are weeks to months away from monoclonal antibodies that allow us to treat and prevent the disease, as well as vaccines will enable us to, as the President said, move beyond COVID eventually. And we need to bridge to that. We need the American people to hang in there with us. And our message about what they need to do is very clear. It's wash your hands, watch your distance, wear your face coverings when you can't watch your distance, stay out of settings where you can't do those things, and especially right now.
So when you have a spectrum of disease from no symptoms to fatalities, it's very hard for the American people to understand that because we're used to things looking the same. We're used to people getting the flu, going to bed, getting chills, feeling terrible. We're used to that. It's hard for us to comprehend that more than 50% of the people could not have any symptoms and others could die from this disease. And so that's why it's really important for people to know, as the Secretary said, someone in this room right now could be asymptomatic and positive, not know and be here because they don't have symptoms. And so really getting that message out, because I know you doesn't mean you don't have the virus, I think is really critically important. But I understand that that's difficult to understand because it always is difficult to understand that spectrum of disease, from no evidence of disease to people succumbing to the exact same virus.
And what I'm hearing from all of you is a unified message, which I believe the American people do seek out. However, the question is there have been mixed messages from those in leadership, and we want to clarify any confusion. So anything you would like to add on that to add clarity and accuracy?
Marni, I would just be very clear. I am the President's health secretary. I speak for him, and I'm telling you, our strategy is reduce cases, reduce hospitalizations, reduce mortality, wash your hands, watch your distance, wear your face covering when you can't watch your distance, and stay out of settings when you can't do those things. That is the message of this administration and the strategy of this administration for dealing with the coronavirus, and that is from the President through me.
When I talk to people and they ask me about politics and mixed messages, I really try to help them understand that what many people view as politics and mixed messages comes down to two things. Number one, it comes down to this debate between reopening and mitigation efforts. And I would say to the American people, that's a false choice. And you need to reject that choice. You need to understand that we can safely reopen. We've seen that happen in New York City, where they drove down their positivity rates to under 1% for most of the summer. Worst in the world to under 1%. We've seen it in Arizona, if you want a red state, where they were the worst in the country, or among the worst in the country in the beginning of the summer. Within a few weeks, they drove down their positivity rates and became a green state. It is a false choice to feel that you have to choose between reopening and mitigation efforts. We don't want to shut down, but the way we stay open is by following the 3 W's, washing your hands, wearing a mask, and watching your distance. And also when people talk about politics and mixed messages, I think that they are hearing this tension between optimism about how far we've come, but also pessimism or realism about the challenges that lie ahead. That again is a false choice. We need to understand we've come incredibly far. Mortality rates are much lower than what they were. We have better drugs. We have over 114 million tests that have been done in this country. We've put testing in communities of color and vulnerable communities. 70% of our federally sponsored community-based testing sites are in communities of color. CDC now collects data demographically based on race and ethnicity that they'd never done before. We've made a lot of progress and people need to understand that, but we also need to be realistic about the challenges that lie ahead as we go into the winter. And we need to stay the course because we are almost there.
The vaccine is critical. I'm not telling you anything you don't already know. The biggest question that I hear from people is, when will the vaccine be ready? And will it be safe for me and my family to take?
So in terms of the vaccine timelines, we have 2 products that are almost fully enrolled in their clinical trials, Pfizer and Moderna's vaccines. We have 6 vaccines total that we have invested in or contracted with, 4 in phase 3 final stage of clinical trials, these 2 that are almost fully enrolled. We can't predict when we'll get data from them, because unlike just a therapeutic where you have someone who's sick and within a couple of days you can look at a clinical outcome to see if they've gotten better and gotten out of the hospital, with a vaccine you're looking at actually either preventing them getting the virus or lessening the disease progression in them if they do get the virus. And so that means you vaccinate thousands and thousands of people. In each of these trials, 30,000 people, half of them get the vaccine, half of them get a placebo, and you have to then wait until a certain number of people get coronavirus and symptoms in that trial. When we get that data, that will be an independent process. There'll be an independent, it's called a Data and Safety Monitoring Board, that will determine that pre-specified statistical endpoints have been met. That will then go to the drug companies and the FDA. The drug companies will determine whether the data meets their ethical standards to submit for FDA approval. They'll go to the FDA. FDA will consider that data against public guidance that they've already laid out saying what the standards are. They'll hold that to. They'll use a public advisory committee process to get external input. And the FDA career scientists will make the call as to whether a vaccine meets the FDA's legal, regulatory, science, and data standards for approval. So we don't know the timing of when we'll see the data. The Pfizer CEO, the world's leading global biopharmaceutical company, has publicly said that they think that we could see data from their trial as early as late October, so next week. And they have said that once they get that data, it'll take them time to clean up the data and be ready to submit, and they would submit by late November. Stop and think about that. That's 10 months from the entry of this virus to the United States. This is historic and unprecedented achievement thanks to President Trump's leadership and vision of Operation Warp Speed.
No one will deny that 10 months is fast for a vaccine to come to market, but there is a saying, you can't rush science. So can you address those concerns that are valid that people do have, given what you've already stated about the process and the approval?
I think it's really important for everyone to understand that the reason this is faster is because they moved everything consecutively. In many cases, you have large delays in between because pharmaceutical companies need to make money. And so they investigate what the utility of that drug or vaccine will be used. Will it be acceptable? How will it be used? And then they determine the market impact of that vaccine. That was all taken off the table because the federal government said, if this vaccine is safe and effective, we're going to make the decision right now to manufacture it. And so no shortcuts were taken in the science or the safety. What it did do is cost a lot more. And I think that was an investment made by the federal government to say it is worth it with this kind of pandemic to make those kind of investments.
There were horrific things done to people in this country, particularly people of color, in the name of science historically. We need to acknowledge that. We need to help everyone understand that there are protections now in place. The Office of Human Research protections, which the Secretary oversees. Independent data safety monitoring boards, which have to unblind the data before it even gets to the FDA. An FDA process which is recognized around the globe as the safest in the world and the safest of all time. And probably the most reassuring thing I can tell the American people is that as a black man, as the Surgeon General of the United States, as a practicing physician, as someone who has a master's in public health, I will be getting a COVID vaccine when they tell me it has been authorized or approved and that I can get one, and that my family will get a COVID vaccine when they are told that they can get one, because I trust the process. We're in the midst of a social justice movement right now. I think one of the greatest injustices in the world are the people who are pushing misinformation out there that is causing minorities in particular to disproportionately be harmed by vaccine-preventable diseases. 50% of Americans get a flu shot in any given year. Only 40% of Hispanics and African Americans and Native Americans get their flu shot every year. That results in tens of thousands of people of color dying every year because of a lack of vaccine confidence or because we haven't done enough to make it easy for them.
I have 3 kids at home. Right now they are remote learning. I would like them back in the classroom. They would like to be back in the classroom, but to be honest with you as a parent, I don't yet feel comfortable sending them back into the classroom. What is the right answer? What should I do and what should other Americans do when making this difficult decision?
Well, they ought to have the opportunity to be back in the classroom. Almost every Western democracy has their kids back in their K through 12 schooling, and the United States should be the same. We have the public health tools to work this problem and keep our kids safe, keep our staff and our faculty safe. It's the basics of public health we've talked about washing your hands, watching your distance, wearing your face coverings when you can't watch your distance. We can configure our schools in ways that create social distance. We can protect the kids by having the teachers rotate between rooms. We can bring meals to the kids in class to prevent congregate settings like cafeterias or assemblies or auditoriums. We can cohort the kids in terms of transportation to and from school. There is a very important and real cost to kids being kept from a physical learning environment. It's not just the importance of their intellectual development, but there's also physical development, mental health development. So many of our kids get their basic medical and nutrition services in a school-based setting, and they're being denied that. Even some of the abuse detection systems that we have depend on that physical environment to look for signs and symptoms of child abuse or neglect in those. So there are so many costs that come from not being in a physical environment. We can do it when we put our mind to it. Every individual parent, though, needs to make the decision and have the choice if they, for their own individual circumstances of their family or vulnerable household members, shouldn't go back to school. That should be a choice that is respected for them. But we should also all have the opportunity for our kids to be back in a physical school environment that's safe for them and the faculty.
And Dr. Birx, I know you've spent a lot of time at colleges and universities. Are we doing enough to mitigate the virus in those settings as well, given what we have learned about the pandemic in the last 10 months?
You look at the data from the colleges that have had mandatory testing either twice a week and once a week. The colleges have been testing just the symptomatic students and then doing asymptomatic surveillance, wastewater testing. There was an initial peak as people got together, and then the middle group, the majority of students have really been following the guidelines, and those infection rates that were at one time maybe 500 students are down to under 50, showing that even 8 weeks in, the students are following these guidelines and making these sacrifices.
According to Johns Hopkins, as you know, we are at 8,201 plus confirmed cases, 220,020 plus deaths. These are more than numbers. These are people's lives. These are families that have been torn apart. I'd like to know from each of you, what is your personal reaction to the state of the virus and the toll that it has taken thus far?
I think about family members and friends of mine personally who have had the virus. And fortunately for me, none of them have succumbed. But I think that reflects a very real difference in outcomes if they had gotten it in March and April versus getting it now with remdesivir, with steroids, where many more people are going home to see their families again and where length of stays in hospitals are much shorter. But I also think about my 3 kids, 16, 14, 10 years old, at home right now doing virtual learning and really having a significant, I'd say, diminishment of their school experience because of this virus. I think about my wife, who had a cancer diagnosis delayed and who's undergoing cancer treatment right now. I hope she does well, but again, there are real negative outcomes for people who are living through this pandemic apart from the actual virus itself. And so what I want people to understand is that we really have to get this virus under control, not just for the sake of the virus, but for the sake of the other negative outcomes, mental health, school, delayed diagnoses of other diseases. And I want people to also understand we are weeks away from having a vaccine. And all we have to do is stay the course. We've got to follow my 3 W's, wash your hands, wear your mask, and watch your distance. This is not political. I consider it patriotic to to wear a mask because you're protecting your country and you're protecting our ability to stay open. And I really hope we can get away from this idea of opening versus health, because the way to open and the way to stay open is by promoting health.
There's a very real human toll from a global, unprecedented pandemic like the coronavirus. But I think about what would have happened had the president not taken such early, decisive, aggressive leadership, such as shutting down travel with China, shutting down travel with Europe, and then the 45 days to slow the spread that was truly unprecedented action by any president. And at every step of the way, the president was criticized for being too aggressive, being too strong, taking too many measures to protect the American people. We know people are tired, they're fatigued from the mitigation steps. They've been kept away from work, from school, from worship, from healthcare even. But we need them to just take the simple steps. Wash your hands, watch your distance, wear your face coverings when you can't watch your distance, avoid settings where you can't do those things, because we're bridging really to a very near period where we will have next generation therapeutics, monoclonal antibodies that will allow us to prevent and treat the disease, and vaccines that will enable us eventually to get out of this situation.
Since March, as we tracked it up through the Northeast, through Chicago, through Detroit, and into New Orleans, I mean, seeing the level of stress on the healthcare workers, the stress on the families, the inability to visit, I think we all were just really devastated by what we saw in March and April. And being able to translate that into rapid movement on vaccines, rapid movement on therapeutics, and frankly, really increasing our ability to test, allowed us across the South then, when we confronted that in the summer, to have a much more coordinated, aggressive response that brought together real efforts at mitigating as well as really saving lives in the hospitals. And so our fatalities for the number of cases was much lower.
We are seeing pandemic fatigue right now. It is a reality from coast to coast and everywhere in between. This pandemic is like nothing that we have ever seen in our lifetimes, and I pray we never see it again. With that said, people are turning to you all for answers and for hope and for the path forward. What is your message to the American people? What is the message to your own families right now as we take this next step?
Well, I have a complicated family because I have 1-year-olds to 96-year-olds. So that just shows you how the message has to be able to be reached every single one of those individuals. And what I tell them is we're going to do this together. We're going to make it to the end to when we can get a vaccine and they can get a vaccine and they can have immunity from the vaccine, and then we can do those things again. Because right now, because we know the virus is still out there, you can see the cases rising. You can see where it moves. It moves because it moves in the communities and it moves between individuals. This virus can't do anything outside of our bodies. It is dormant, more or less, outside of our bodies. If it doesn't use our cell machinery, it can't replicate itself. So it needs us, and we have to prevent it from having us. And I think we know that simple approach. I know it sounds so common sense that it almost seems like it's not science, but it is science. Each one of these items, wearing a mask, has science behind it. Physical distancing, science behind it. Washing your hands, science behind it. Avoiding indoor gatherings outside of your bubble, which is probably outside of your household at this moment in time. If you're in a county with rising cases, you need to take all of those into account religiously, continuously. I know it's hard. I've been on the road since the end of June. But you can make it and do these changes. It just is hard some days. And you have to help each other remember. You have to have someone with you, someone in your family looking out for each other and reminding you, do you have your mask? Remember to stay physically distant. Public spaces, by and large, have gotten very safe. So when I'm out, I feel very comfortable in public spaces, whether it's a CVS or whether it's a restaurant or whether it's a hotel. I worry what's happening when people go indoors and they think they're protected because they're with the people they know. But if they're outside of your bubble, they could very easily carry COVID. And that's where transmission is occurring. And that's what we have to be telling the American people. Everybody has to adjust in this moment. where we can no longer do as much outside and really change their behaviors back to not only wearing the mask and physically distancing, but ensuring the protection of others indoors.
Secretary Azar, are you hopeful?
I'm very hopeful, but my message to the American people would be first, we appreciate how much people have given and the sacrifices that they've made over the last 9-10 months. My father died. I wasn't able to be with him in the months before he died. I have not been able to mourn his loss in any type of communal setting to celebrate his life or anything. So I know the pain and the just sense that everybody has that they have given so much through this unprecedented pandemic. But my message would be, we're in such a better position now than we were even 6 months ago in terms of the ability to treat people, to prevent the spread of disease, our knowledge of the disease, and then the tools that we will have. We're going to be in such a good place, and it really is weeks, months away that we will have monoclonal antibodies to prevent and treat the disease. We will have vaccines to prevent the spread of this disease and eventually get us to where we can move beyond COVID. But right now, we all need to do our part. We ask you to hang in there with us, because it doesn't matter. Open state, closed state, red state, blue state, closed country, open country. The disease spread is identical across the world of Western democracies right now. Cases are increasing because people have gotten tired and they are not following those basics of public health. Wash your hands, watch your distance, wear your face coverings when you can't watch your distance, and avoid settings where you cannot do those things. If we do those things, we bridge to that day that has me so optimistic thanks to President Trump's leadership. It's really this historic moment where we will have novel therapeutics and vaccines within months of a novel coronavirus hitting our shore. It's never happened in human history before that we have harnessed the power of our biopharmaceutical innovation like this, and we'll have it in supplies to treat and prevent disease for the American people. And so bear with us, hang in there with us, because the coming weeks and months are so hopeful in terms of our ability to get back to school, back to work, back to worship, back to healthcare, and back reconnect in our civic, political, and community life, and just to be with friends.
Mr. Secretary, my condolences to your family and the loss of your father. Dr. Adams, I will give you the final word and the final message.
What I would say to the American people is to be vigilant, but have hope. And that's the message I give to my 3 kids, to my family. Be hopeful, because we are weeks to months away from having a vaccine. Be hopeful, because we know how to keep this virus under control, and we've seen it happen in Arizona, in New York. Wearing a mask, washing your hands, and watching your distance can help us drive this disease into the ground. Be hopeful, because if you do, unfortunately, get coronavirus, you have a much higher chance of surviving it now, thanks to innovations in the way we treat people and to therapies such as remdesivir, steroids, and monoclonal antibodies. Be hopeful that you can have spring break next year and that you can have an in-person graduation. But also know that that is only going to happen if we pull together. So we are in the end of this race, I think, and we just have to keep running. We've got to keep running through the finish line until we get a vaccine and we get enough for everyone who wants to get a vaccine to be able to be vaccinated. But we're so close, and we just can't afford to let up, because that will mean lives lost unnecessarily. So be hopeful, be optimistic, but stay vigilant, and get your flu shot this year. Incredibly important. It's already something that we have available to us that can save lives and lower the stress on our healthcare workers and actually help keep us open.
Thank you for the important work that each of you are doing. My best to you to stay healthy, and thank you for taking the time to talk to us.